One day after 3,000 doses of the AstraZeneca vaccine arrived in Guyana compliments of the government of Barbados, scores of frontline healthcare workers and senior officers of the Georgetown Public and Infectious Diseases hospitals queued up to receive their inoculation as a form of protection against COVID-19, which continues to bring Guyana to its knees. The historic vaccination drive commenced at the Georgetown Public Hospital, where Brunette Bernerai, a pharmacist, was administered the inaugural jab in the presence of Health Minister Dr. Frank Anthony and other health officials. Describing the event as a historic moment, the Health Minister said it marks the beginning of a turnaround of the pandemic in Guyana.
Our intention is to ensure that we reach herd immunity, which means that over the next couple of months that we would be able to secure enough vaccines. So most of the adult population here in Guyana would be able to get those vaccines. We are extremely pleased that to initiate this process.
He noted that healthcare providers at the Georgetown Public Hospital were specifically targeted in the first wave since the institution has been the epicenter of the almost year-long fight to contain the spread of the disease.
They have been the ones where the most severe patients have been coming here, and they have been interacting with these patients, so the staff here is more at risk for contracting COVID-19.
Altogether, the ministry is aiming to immunize 22,000 healthcare workers from both public and private institutions, with additional vaccines that are expected to arrive later this month and in March. The vaccination campaign was simultaneously launched at the Infectious Diseases Hospital at Liliendal, East Coast, Demerara. After taking his first dose at the facility, Director of Medical and Professional Services, Dr. Fawcett Jeffrey, explained that it was quite painless.
Taking the vaccine, it wasn't painful. It was like any other little stick. You will feel that there was a stick, and there's no pain at all associated with it.
Another recipient of the vaccine, Dr. Dave Prasad, a medical registrar who has worked in the COVID-19 intensive care unit for the past 10 months, opined that the vaccine is indeed a game changer in the battle against the pandemic.
Certainly life-saving. As you rightly said, I would have seen patients with severe forms of it, and I can tell you it's very sad to see so many people die in front of you for something that potentially is preventable. Of course, we are still to maintain all of the different recommendations as it relates to how we interact with each other. But now to additionally have a vaccine, hopefully this would help curb the pandemic.
Although the AstraZeneca vaccine is yet to be recommended for an emergency use listing by the World Health Organization, it has undergone review by the European Medicines Agency and consequently meets WHO's criteria for Strategic Advisory Group of Experts, SAGE, consideration. The World Health Organization says Oxford's coronavirus vaccine is safe and likely to be efficacious in older adults and recommends that the vaccine doses be administered at an 8 to 12-week interval in people aged 18 years and older. Timeka Rodney reporting for the HGB Nightly News.